Okay, so I go see my favorite OBGYN, and she looks at me and go, girl, listen, you pregnant again? And I started laughing. And I said, am I going to see a specialist this time? She's like, abso-freaking-lutely, you're going to see a specialist. So she scheduled me to, she referred me to an MFM doctor, which is maternal fetal medicine. She had me do some blood work, and they did another ultrasound. And she's like, okay, let's go. Here we go. So I was so happy. I saw my, I would see her, and then a week later, I would see the MFM doctor. The pregnancy was going well. I got big, gained weight. I told my sister-in-law, I said, guess what? She's like, you're pregnant. I said, yep. She's like, oh my goodness. Of course, I had to stop taking the Zepbound because you can't do that when you're pregnant or breastfeeding. And I was pregnant when I took my third dose. I did not know. I was pregnant when I went to the event, and I was sick as a dog, and I had a couple of those drinks, so of course I was worried, but everything was fine. And as time goes by, my doctor, my primary care was like, yeah, metformin is known to help fix, you know, certain things. And then they had all this stuff come out about people who have been taking like Wegovy, Zepbound, Ozempic, and they ended up pregnant. Like, they can't, I don't really know what it is. So they're thinking that the Zepbound with the metformin helped me get pregnant. And so I had stopped taking the metformin a while before, and I stopped taking the Zepbound. I didn't want to take any medication on this pregnancy, not even Tylenol, because they started saying Tylenol had something to do with kids having autism and stuff like that. And my son has autism, and I was taking Tylenol with my other children for pain because you can't take ibuprofen. So I was like, in this pregnancy, I'm not taking nothing. So my blood pressure started going up. So they gave me blood pressure medicine that was safe for the baby. I said, listen, you're giving me this, it's a level C. I don't take any medication that's lower than a B. A and B, I feel comfortable taking those medications. Like, you can look it up online to see what letter that medication is. And A and B are medications you can take during pregnancy that they know they hasn't shown any issues with pregnancies. But C is like, they're not sure. I don't deal with that. So they found me heart medication that was in the B section that I would take. And I had pain, but I wouldn't take Tylenol. I took nothing. I just dealt with it. And farther along in my pregnancy, they realized that I had placenta previa. And my doctor, of course, when she heard this, she was like, my GYN was like, she's like, okay, I'm telling you, this is serious. She's like, I want you off your feet. You can't be intimate the rest of this pregnancy. She's like, your placenta is like, the placenta is like this. It's like facing a different way than it's supposed to. And sometimes if the placenta gets stuck to the uterus, when you have the baby, there's a lot of blood loss, and you have to go to the ICU to get transfusions, and you have to be there, and the baby can't be in the ICU. So I was like so scared. I'm like, great, here goes another damn thing that's happening. But this time I have my doctor and a specialist, so I'm good. The thing she was afraid of happening, they kept checking it. I was like 6 months pregnant. They're checking it. Okay, nothing has changed. You still have it, but sometimes it changes on its own and it goes back to normal. It never went back to normal. And my doctor's like, listen, after this pregnancy, I'm gonna suggest that you get your tubes tied, because we don't want, like, first of all, this will be your 6th C-section. Well, no, not my 6th. Yes, my 6th C-section. I'm lying. No, not my 6th. It would be my 5th C-section, but I've also had surgery. So it's been, so it's not safe for you to keep doing C-sections. The more you do it, the more scar tissue you're gonna have. Even though I was told that she did a fantastic job because I didn't have any scar tissue when they got my baby girl out the last time. So I was like, okay, I'll think about it. She's like, or you can just make your husband snip too. And of course we laughed about it. And so, yeah, that's where I'll stop right there. And I'll see you guys next time.